There is now an abundance of evidence of how creativity can impact our health and well-being. But how do creative health services show up in our healthcare systems? Today we'll be hearing from 4 health leaders who will be helping us answer that question. Firstly, we'll be hearing from Stephen Sanford, who will be telling us about integrated care boards.
So ICSs are really engaged now with a whole range of partnership working, including the voluntary, community, faith and social enterprise sectors. But I don't think that creative health really see themselves as part of that space. And I'd really like to see in the future and now, those partners, our arts partners, culture partners, making their way into that space, because that's where they can have more of an equal voice. I think the best place for creative health to show up in an integrated care board is within our population health directorates, our population health teams, because they are best placed to draw the arts and culture sectors into a conversation around how health is created. What I know about arts and culture colleagues working in our communities is that they know who our communities are in a really particular way, and through actually the fact that they can engage our communities often in ways that we can't as health colleagues.
Next, let's hear from Laura Waters, who will tell us about hospital arts.
So my role is Head of Arts at a large hospital trust in the Midlands at the University Hospitals of Derby and Burton. So my job is to pull together a whole programme with a variety of different art forms and different approaches so that we can try and create an environment that is welcoming and calm and healing for everybody who comes into that space. And a lot of the time when people experience this within the hospital space, it's something that they can then take away with them, and they might then start doing something when they get back home, or they might continue to do that activity to keep themselves well in the future. I think creative health is a really important next step for our health services. I think it's got to form part of what we do in the future for holistic care of patients and the well-being of the nation, both public health and in our hospitals and in GP practices. For the next 5 years, I would love to think that every single hospital in the UK had an arts programme. I think it's really important to make hospitals holistic caring environments, and an arts programme is one way in which we can do that. At the moment, there are around 50 arts programmes in the UK in hospitals. We need to make that available to as many hospitals as possible so they can all benefit from supporting patients and staff with creative health.
Our third leader is Rhys Boyer, who will talk to us about creativity in public health.
I think within my role and my context, very much as a local authority officer, is that advocacy approach. So I very much as that middle person between some of those very large organisations and what some of their priorities are, but also then kind of advocating as a local authority officer, as a city council, for our citizens about how we best protect both their health, their well-being, and overall their overall social economic status. There's a lot of areas in which creative health can interweave and fit in. And I think it fits in with a lot of context within public health and creative health within any kind of setting. And I think it's been open to explore the research and explore the evidence base, because it is there. If it's the plethora of public health outcomes across the 4 domains, I think it's having that open mind as a public health professional to the value that creative health can have, both on your work, but for everything, the citizens and the patients that you're serving. I think where I'd like to see creative health within the next 5 years is kind of more so having that formalised framework. And I think it's really good to have one nationally across England, but one that also then perhaps is dedicated towards some of those distinct policy areas. So one that's more dedicated towards NHS and that kind of primary and secondary care aspect. But also then, I guess for my context, how it's specific towards local authorities. And very much, as I've touched on, our role is about conveying health messages and getting those across to communities and making them a little bit more unique. Stuff that we're doing here in Birmingham could help build that and can help replicate it as well.
Finally, what is the place of combined authorities? Mubashir Jazz will be helping us answer this.
The councils, local authorities' role is very much delivery on the ground with the people. Our role at the combined authority is to be, like I said, to add value to what they're already doing. and see if there's something that we can scale, if there's evidence that we could collate, if there's stakeholders that we can bring together, convene, more strategic in a sense of bringing things together, bringing people together, and supporting the gaps that exist. Beyond that, we've started a task and finish group to bring together the key stakeholders across the region, across the country, actually, to learn from them, collate the evidence, make sure we have a robust theory of change developed, and ensuring that it is an integrated approach. So it's not something which is isolated from what's happening on the ground. Once we have that, I think then what our plan is to be able to invest in some test and learn pilots and then build that into the evidence base and contribute to the evidence base nationally.
This is just a small selection of examples of how creative health is being recognised and integrated across our systems. For more information about creative health, you can visit the NCCH website at www.ncch.org.uk. Thank you for watching.